Welcome to today's Disaster Zone TV show. With me today is the King County Health Officer, Dr. Jeff Duchin. And we'll be talking about COVID-19 pandemic and also the intersection with the 2020-2021 flu season. And welcome, Jeff. It's great to have you on the show again and look forward to our conversation.
Good to be here, Eric. Thank you.
Jeff, you know, I keep track when I meet people, and it was April 11th, 2020. I was at a emergency management conference. I went to a session that you briefed on pandemic flu, and that was my aha moment where I became self-aware of how bad a pandemic, you were talking about flu at that point, could be. So what's the significance of the upcoming flu season coinciding with the actual pandemic that we've been in now for 5-6 months?
Yeah, Eric. So pandemic preparedness has been an issue for science and public health professionals for quite a while. And it's true that influenza was the leading suspect to cause our next pandemic, although coronaviruses were probably very close second. And what we're going through now is a new emerging coronavirus pandemic, a virus that emerged from an animal reservoir, as most of our human viruses do, and is spreading very effectively throughout a human population that has no previous exposure to this virus. Influenza viruses also exist in nature in animal reservoirs and periodically can infect humans, the animal viruses, and can result in new human strains of influenza that can cause global pandemics. We're not currently having an influenza pandemic due to a novel influenza virus, but that remains a possibility. What we expect this season, though, is more or less the run-of-the-mill influenza viruses that are well established in humans. And the extent to which we will experience an influenza outbreak this year, like most years, is impossible to predict in advance. One of the things that we're very concerned about is that if we have a severe or even a normal influenza season, the number of illnesses that will happen in our community with the combination of influenza and COVID could be very, very stressful, both to us as individuals who become infected and to our healthcare system, which can become overwhelmed and is stressed even during a normal influenza season. So we're very concerned about the combination should influenza take hold and start spreading in our community this fall and winter.
Okay.
Yeah.
No, go ahead.
I was just going to say that because of that, we're really encouraging folks to do everything they can to minimize their risk of influenza. Now, taking COVID prevention steps like minimizing your activities and interactions with others, which is critical to prevent COVID-19, and wearing masks whenever around others outside of the home, and avoiding poorly ventilated indoor air spaces and having good hand hygiene, washing hands frequently. Those steps prevent not only COVID-19 from spreading, but also other respiratory viruses like influenza. So if we do a really good job with our COVID prevention measures, we will probably see an effect on influenza transmission as well. But in addition, we really need to take advantage of a vaccine that we have for influenza that we don't have for COVID. So we want to use every tool possible to minimize the risk that people will become infected with influenza, which could be confused with COVID. The symptoms are similar. Someone comes down with symptoms of influenza, they may feel like they have COVID and no one will know until they're tested. And so we'll be having to recommend people be isolated and quarantined and tested for both COVID and influenza, and reducing your risk of getting anything that would be potentially confused with COVID is really important.
Yeah, one of the things I've seen is through COVID, it's a novel virus, and so the guidance has changed over time. You know, people point out, well, we weren't supposed to wear masks, but now we're supposed to wear masks. And originally, you know, hard surfaces were thought, well, that's a significant disease transfer type of vector, and then, well, no, it's not so much. What can you say to speak to that issue that, you know, the guidance changes over time?
Yeah, it does and it should, because with any new emerging virus, we base our initial recommendations on the science that's known at the time. And so we use what we knew about related coronaviruses such as SARS-CoV and MERS-CoV to guide our initial response. But those viruses are different, and thankfully, because those viruses have a much higher fatality rate, for example, and they also spread very differently. So the SARS and MERS viruses spread primarily after someone becomes symptomatic, whereas the novel coronavirus 2, SARS-CoV-2, which causes COVID-19, can spread very effectively before someone feels ill and develops symptoms. So as we learn more through observation and studies of the new virus, and as more and more people become sick, we have to change and update our guidance, and our understanding of the disease evolves, which is perfectly expected. One of the things that we've always understood is that in new emerging infections, there's tremendous uncertainty, and we should expect uncertainty, and we should expect information to become clarified and data to become improved over time.
Okay, I think you're right on, and we can expect guidance will change even more, going forward as we learn more about the disease, age groups, transmission.
Absolutely.
What will getting a flu vaccination do for the individual? What's it do for the broader community?
Well, for the individual, it will reduce their risk of developing influenza infection. And that's valuable, but even more so, it is more effective at reducing the risk of hospitalization and severe outcomes, such as death in those high-risk persons who are susceptible to those severe outcomes, such as people over 65 and those with underlying health conditions.
I resemble that remark. Yes.
I know.
Now, if you go to get a flu vaccine and you are over 65, will you automatically get the higher dose? Is that just automatically done?
It should be, but I would definitely check. I would ask for either the higher dose or the adjuvanted. There are two formulations of flu vaccines that are available for people who are over 65 because they produce a stronger protection, stronger level of protection. So ask if you're 65 or older for the high dose or the adjuvanted vaccine.
Okay, shoot the juice, Bruce, for me. Here's a quick question for you. When should you get your flu shot? We're right now early in September, and I've seen signs up, get your flu vaccine shot here. Is it too early to get it, or what's optimal?
Well, the key is not to miss an opportunity. So if it's now or never, or you think you might forget later, take advantage of getting it when it's available. If you're the type of person that really likes to time things perfectly and you're confident that you're not going to miss the opportunity to get it, waiting until October is fine. But we encourage most people to get vaccinated, starting in September and through the entire flu season, because when flu is around, when it's circulating, it typically starts in the early winter, late fall, and extends well into spring. Again, we can't predict what we're going to see this season, but it's better to be safe than sorry, because the vaccine is safe and effective and will help in the context of COVID.
Okay. And really last question, there is an unfortunate part of the internet today is there's information is everywhere, and there's all this misinformation, actual disinformation. So there's an anti-vaccine movement out there where people read things. I just saw a story where people are going to their doctor and saying, I just heard or read on Facebook such and such. And so what would you tell people who are concerned about side effects of actually getting a vaccine causing other diseases or issues long-term for the children or what have you?
Well, first of all, I would say the bottom line is go to your doctor. Your personal physician or healthcare provider is really the best source of information about vaccinations and other treatments. There's also lots of information about all of the licensed vaccines from reliable sources online, but sometimes it's very difficult to sort out what's a reliable source from what's not. And some of the unreliable sources have very misleading names, which might imply that they are more trustworthy than they are. I will say that the Advisory Committee on Immunization Practices in the CDC vaccine safety site is excellent. The National Institutes of Health vaccine safety site is excellent. The Immunization Action Coalition, Children's Hospital of Philadelphia. Go to a site that's affiliated with a healthcare center, an academic center, or even better, your own personal healthcare provider to get the most accurate and personalized advice.
Yeah, I mean, in the age I grew up in, the phrase was, didn't your mother tell you not to read or believe everything you read in the newspaper? Well, the newspaper of today, information source is the internet. So be prudent and watchful what you do consume, and better on medical issues, consult with reputable medical professionals like yourself, and then all those that you listed. So Jeff, I just want to thank you for being on Disaster Zone TV today. It's been great to have Dr. Jeff Duchin, the Seattle King County Public Health Officer. He was trained as an epidemiologist. This is his field of expertise that we've been talking about. Thanks for you coming on, talking about COVID-19, the pandemic we've got, but then that intersection with the flu.
Thank you.
For you people at home, now, if you haven't gotten ready, get prepared for the next disaster and get that flu shot. Thanks for watching and tuning in again soon. Bye-bye.